In the Berrien County Health Department. I'm joined by my favorite Friday partners, Under Sheriff Chuck Hite and Dr. Lauren Hamill. We're going to go ahead and take off our masks so that you can more clearly hear us. And for those of you that lip read, you can see us moving our mouths. Just squirted some. All right. Well, thank you all for joining us. We're really glad to be spending Friday afternoon with you again, having this bit of time to do an update. Last week we did have a little bit of technical difficulty. We're pretty certain we've got all the kinks ironed out. We did extensive testing over the last week or so to make sure our new equipment was working. Hopefully that sound quality is really great for you as well, as we did implement some new equipment to help with this. So want to get started just giving you an update. For those of you that are following us along on social media and or tracking our dashboard that's on both the Health Department and the Berrien County webpage, you can get to it from a variety of ways. We are now sitting at 376 confirmed cases. We have 174 presumed cases, and again, those presumed cases are people that are ill. They have symptoms consistent with COVID-19, but they have not been able to have a laboratory confirmation of their illness for a variety of reasons. We do have 22 deaths at this point, and we're happy to report that 216 people have recovered. So I know a lot of you are watching the data, and we've been getting a lot of questions about some of those trends, because we're watching the data to help inform when can we remove some of these things like social distancing. I know I'm growing weary of it, just like everybody else is too, but we do think that it has been effective, so we want to keep monitoring the data. There has been a little bit of an increase in the number of deaths that we're seeing. We've had 9 deaths since April 26. So that is something we're paying attention to. You do expect an increase in deaths to lag a little bit behind an increase in the number of cases, so that's not exactly out of what we've been expecting based on what we've been seeing. And we are seeing a little bit of an increase, very slowly, but a little bit of an increase in hospitalizations. And I want to turn it over to you, Lauren, to help us understand that.
Yeah, we have about 20 in the hospital now, and it hovered around 8, 9, 10, 12 for quite a while, but we're at 20. We have still a lot of capacity, so we're not running out, and we hope not to have to use that capacity. We are able to stand up 67 more beds than we normally have, and a second ICU, which we currently are using as an isolation ICU. But you're right. The diagnosis comes ahead of the hospitalization, and of course the hospitalization ultimately, usually a week or two before people die. So there is that lead lag. But seeing that increased cases means we have to be careful.
Right, and this is really sensitive. Some other things that the health department is continuing to do is we're monitoring what's going on in nursing homes and long-term care facilities, and we know that there is some transmission going on in several facilities in Berrien County.
And across the country.
Across the country,
very hard.
Yes. But we do know that is a more vulnerable population, more susceptible to being hospitalized, and some of that is also driving an increase in our hospitalization as well. We've also been doing a lot more testing in Berrien County, haven't we? And that's probably why we're seeing more cases.
The numbers are up, exactly.
Yeah. Can you tell us a little bit about what testing is looking like at Spectrum Health Lakeland?
We're expanding our testing every week or two. We get more capability, and we're doing that as broadly as we can. And a number of other places are testing as well, which is a really good thing. So it's not just on one organization to make those tests available. So there's a lot more tests available. Antibody tests are still pretty scarce.
Yeah.
And we're committed to ramp up the antibody testing, but it's just not available yet. We're kind of dedicating that antibody test to those folks that think they had the disease and are willing to be plasma donors.
Yeah.
That's a perfect use of that test, because it not only helps confirm their diagnosis, but it helps save lives when we're able to use them as plasma donors. So at least for now, we're trying to limit it to that subgroup of people who were sick and didn't get an initial COVID test to confirm it. And we're using the antibody test instead to confirm it.
Yeah, and you mentioned the convalescent plasma. So a couple weeks ago, you reported that process had started here locally, and that there had been a patient or two that had received plasma. Do you have any other updates for us?
Yeah, we're continuing to do that, and several every week. It is, you have to have a match, you have to have a willing donor, and a match with a patient who's sick, and of course the patient sick are meeting criteria as well. But I think that's going to be a critically important ongoing treatment for folks that are sick enough to be in the hospital. So we certainly encourage you folks, if you've had the disease and you've had the test, we're going to have to repeat it and confirm that you don't have the virus, and we could use your plasma, and that can help save up to 4 lives. I have to say, one of those lives that probably was partially or saved is Lowell, my twin brother. He got the plasma, convalescent plasma, and 3 or 4 days later started to get much better. Now, he also had, I think, 3,000 or 4,000 people praying for him. And so I'd like to think that combination was good medicine. But fortunately, he is now recovered.
Yeah, and we're so grateful for that. So
yeah. Thank you very much.
Yeah, grateful for that. So we talked a little bit about vulnerable people in nursing homes, and we know that that's a situation we're monitoring. We have many other vulnerable populations, and I know one is our incarcerated individuals, those in the county jail. Do you want to talk to us a little bit about the jail, Under Sheriff Height?
Thank you. So as we've talked about that, different vulnerable populations, the sheriff has received questions regarding the jail, and obviously jails and prisons are also a congregate care style facility, and we want to give you an update about the current operation. We've been working closely since the beginning with the health department, and we are doing a symptomatic approach to testing. So we have tested 10 inmates in the jail. Those have all come back negative, and I want to thank Spectrum Health Lakeland and their laboratory in helping with those tests and making that happen. Early on, our medical staff and working with the health department did a screening process even before some executive orders were issued. We've canceled all visitors and non-essential people from entering the jail. And one thing we put in place is actually the ability for the arresting officer to not even come in. We've got an ability in the Sally Port for them to finish whatever they need to, and traditionally they would have come in with the inmate, and we're not even allowing them in at this time, just to try and help keep the virus from spreading. Again, we appreciate the working relationship with the health department and Spectrum Health Lakeland and all the assistance we're getting. In addition to our medical staff, we have a contracted medical staff 24 hours in the jail. And we are continuing to do everything we can. But we also know that with the community spread that's out there, even our best efforts, may not be successful. We have been very fortunate so far to not have a positive case in the jail. And I just want to thank our staff and commend our employees for the diligence that they're doing every day. And one additional step the county has done is brought in an outside cleaning staff to clean the medical area and any cells that are being used for isolation, to do some additional cleaning to try and help combat the spread of the virus. So thank you for bringing that up.
Yeah, and those sorts of extra measures and those types of controls and things that organizations are doing to try to protect residents who are living in an institutional setting, whether it be a nursing home or an adult foster care or perhaps even assisted living or incarcerated in the jail, those are really important measures, but it's worth noting you can do all the right things and then still potentially have disease transmission. So if and when there is transmission in some of these facilities, it's not necessarily that the facility is doing the wrong things, but there's lots of things you can do to minimize risk. We just can't ever get to zero risk, and I think that's something that is important to try to think about and understand. When we were talking about testing, we've talked about the testing that Spectrum Health Lakeland's doing, and that has been a phenomenal service. As you alluded to, there are some other players that are doing testing in Berrien County as well. We know InterCare Community Health Network is doing a tremendous job trying to cover population in the Benton Harbor area. They have drive-up testing at their facility regularly, and they do periodically take out so that's wonderful. We have heard that the Walmart in Benton Harbor is starting to do testing. As we get more details about that, we will share that on our social media. And there's some coordination to try to expand testing further in South County, particularly in Niles and in Harbor Country as well. We know that there's just less access to testing down there. So there are efforts underway to try to make that happen. So, we're here, we've completed this first week of May. What are some of your predictions for what we might be seeing as we enter a new month and people are starting to feel a certain way about the sun being out and it being spring, and there's some quarantine fatigue. What are some of your predictions?
There is. Well, of course, we study the models and we're comparing our experience against those models, and you folks are as well. This is continuing. The west side of Michigan didn't get hit as hard, didn't get hit as fast as the east side of Michigan, but we're seeing those numbers steadily and gradually climb. And our prediction, that's going to continue. Mm-hmm. And so it's important, despite being kind of sick and tired of wearing masks and being so careful, it is more important than ever. We have to actually drive those cases down and those hospitalizations down and those deaths down before it's safer. And as you know, around the country, there's a lot of effort to say we got to reopen, and there's states that were behind us in being careful and might be ahead of us in not being as careful. I support what the governor is suggesting, and we need to be really diligent, even as we're opening up our businesses, and certainly on our own business. We were completely committed to stop all the non-emergent cases. But as this ticks on, there are more and more things that are now falling in the category that can't wait. Right. Because this is going on so long. And so we all have to be really diligent, really careful, so we can drive those numbers down instead of that slow, steady climb. Yeah, or at least flatten a little bit more. So yeah, and that's something we've been thinking about a lot, and from the county's perspective, thinking about what is this plan for gradually reopening, so that those gains that we've had, the goal was to slow the transmission, and I think the numbers are showing that even though transmission is ongoing, there has been some slowing, and we can't keep doing everything we've been doing forever. So how do we put a plan in place so that when we are legally able to open different sectors of the economy and have more workplaces, have more movement of people, how do we do that in a way that is safe, that still promotes health and still allows us to have that slowed transmission? So I've been working along with several other partners, with some business and economic development partners throughout the county to try to put together what can we do that makes sense for businesses and makes sense for workplaces, but also helps us keep those health practices in place that help us keep the curve relatively flat. So I don't know, Chuck, if you want to talk a little bit more about what that plan looks like and some of how we're trying to frame this. Sure.
So as you mentioned, the Berrien County Economic Development, working with the health department and some of the local partners, the Chambers, Cornerstone Alliance, and Connexus, through the Emergency Operations Center, we put out a press release earlier today regarding some of those efforts and some great tools that are out there. I know the chair of the Berrien County Board of Commissioners, Mac Elliott, had stated that it's important for us to look at giving our community some sound advice on how reopening safely might look, so that we can prepare ourselves for when the time of reopening appropriately is at there. So, and that's continued to be evaluated. We're following our plan, the Emergency Operations Center and all the partners involved, as Nikki had said. We're proud of the team that has been put together to work on a safe reopening and an economic recovery. The process needs to be data driven, certainly to be done on maybe a regional basis. We recognize that the COVID-19 virus is highly contagious and very dangerous, particularly for those with underlying conditions and those over 65 years of age. The county is looking to move safely moving forward to a gradual reopening, as you had mentioned, while also protecting those who are most at risk. The county board, I know, is requesting a regional approach to be taken to provide for a safe, gradual reopening for the businesses based on our regional data and not necessarily different parts of the state. And I know the county board has asked our elected officials in Lansing to work together for the best interest of all of us. And again, just applauding the team that was put together that I know the health department is a big part of, with economic development and our partners in business, and making sure when we look at reopening, we're doing it safely. Yeah, and so there was a website that was launched yesterday. It's called Berrien Reopens. You can find it at berrienreopens.org. And we'll have the link for that on our social media. I believe it's already there. But you can find guidance. So if you are a small business owner or
an employer, any type of employer, there's some template guidance there. There's some really good recommendations. And then there's some more local flavor is being added over the next coming days so that there's some more specific information on how to interpret that, how to get that into your business. There's a lot of planning that goes into making sure that a workplace has the controls that they need to keep everybody safe. These are new habits. In healthcare, some of the habits that are needed to keep people safe, those are in place because you're accustomed to doing that. For others that might be working in an office setting or some other setting, it doesn't come quite as natural. So getting those plans in place so you're ready to go as soon as you can is really important.
So Nikki, I have a question to ask you. When on earth can I get a haircut?
Oh.
Not right now in Michigan.
Is there any place I can get a haircut?
No, unfortunately,
okay.
there's
I thought
not.
that was going to be the answer.
Yes, and believe me, I'm wishing that I could. My hairdresser is actually in the state of Indiana. I will not be going until it is safe. That is one of those services and those businesses. You can't cut somebody's hair from 6 feet away. You can't really cut somebody's hair with a mask on very effectively. So these are things that are going to be really tricky.
Get over it, right? That's what you're telling me. Just get over it, Laura.
I think we're going to just have to all embrace our inner beauty. So yeah, there could be some really creative adaptations that certain sectors can come up with, and I think this is really a time for innovation and ingenuity, but we're going to have to brace ourselves. It could be a while before some of those more personal services are available.
It will be.
Yeah. So, Undersheriff Height, what else would you like to add?
Just a couple things. Obviously, since last Friday, we saw construction and real estate services open up with the executive order that was issued around that time. Obviously, yesterday, many have heard that the governor extended the current home stay safe order through the 28th, but manufacturing activities will be allowed to open on May 11th, subject to workplace safeguards outlined in the order. Just to mention the requirement to wear a mask or face covering if medically able while inside a closed space open to the public is still in effect in the order. And all the executive orders are available online, and we continue to ask residents to review the most current orders. We understand it's kind of confusing. There's been a lot of them. Yeah. Certain ones replace theirs. When you go to the site, you're going to see this order has been rescinded if it's because a new one's been issued. So we do understand that confusion, but just encourage people to educate themselves by going to them online. The other thing just to end with from our standpoint is part of the operations center. We look at it. We have a human services part of our operations center and plan. The United Way of Southwest Michigan is a big part of that, and we're seeing great work from a lot of our local nonprofit partners, from that area and annex. The United Way of Southwest Michigan has stepped up in providing needed assistance during these challenging times. And a couple examples of that is the Southwest Michigan Community Action held a food truck last Wednesday in Niles, and then again on Thursday in Benton Harbor. And they were able to provide food to 600 households. Another one is the Senior Nutrition Services, distributes about 500 meals daily to seniors in both Berrien and Van Buren counties. So we're appreciative of that. And the other kind of plug is the United Way continues to accept donations on Mondays from 3 p.m. to 5 p.m. and on Fridays from 10 a.m. to 12 p.m. at their office there on Lakeview Avenue in St. Joe. One of the most critical items right now that's being requested is obviously the cloth mask. With all the things about wearing masks, that continues to be an item of need, not only for just their health partners they deal with, but obviously the health department as well. So they are kind of the central for both donations and volunteers. So we just appreciate the work that they're doing along with their other partners throughout the county.
Yeah, absolutely. Those cloth face coverings, very essential. Not everybody has access to a cloth face covering or the skills or know-how to know exactly how to make their own. So that's really important. If you're able to assist your neighbors during this time, that's really important. And again, more information on the website about when and where to drop those sorts of things off. So anything else you'd like to add before we start taking some questions?
No, I think you covered the topic very nicely.
Do you have some questions?
Yeah, so can you mention anything about antibody testing and its availability in our community?
Yeah, no, we mentioned a little about the antibody testing. We can do them. They're not plentiful yet because just the supplies aren't available. We do have the equipment, but are short on supplies. And we're saving that for folks that can become convalescent plasma donors. And so if you've been sick and you can willing to give your plasma to help save lives, we want to test you.
and I'll add with the antibody test, with reopening, there has been a lot of conversation of can we use the antibody test to understand herd immunity or know who's, quote, immune and safe to return to work and maybe doesn't need to wear a mask. And it's really worth mentioning again that we just don't have that level of testing capability. Even if we can detect that there are antibodies present, we definitely don't know what level of antibodies need to be present to confer immunity. We don't know how long it's going to last. And a lot of these tests are just, they're being put on the market under an emergency use authorization. That doesn't mean they've gone through the entire approval process, and it's really difficult to interpret the results because they're not always accurate. There's a high rate of false positives and false negatives. So there is some utility, as you described.
It's going to become better over time.
Yes.
It's just we are not there yet.
Not yet.
To use it for that.
Yep.
So for folks that might have some of those underlying conditions putting them at higher risk for this virus, do they still need to be seeking care and getting treatment for those underlying conditions?
It is incredibly important to take good care of your health. Taking good care of health is an urgent thing to do. And you might be able to put an appointment off a week under certain circumstances, but not 3 months or 4 months. That becomes very risky to your health. So, call your physician and the office and talk about those things. We are making every effort to do everything virtually we can, which means care is at home or where you feel the safest. But some things just can't be done long distance. Sometimes you have to be up close and personal when you're getting that kind of care, and we're doing everything we can to make that a safe environment. So, call and we're there for you.
Absolutely.
We've heard that contact tracing is so important in this process. Can you tell us more about how many people are doing contact tracing and what that process looks like at the health department?
Yeah, so contact tracing is definitely a hot topic, and we've talked about how it's a really important strategy as we begin to reopen, we begin to have naturally more contacts with one another. It's really important for us to be able to follow those threads of disease transmission so we can really stamp it out, so that we can identify who presents a risk of transmission, since COVID-19 is spread person to person. If we can test them, understand who they've been in contact with, and make sure we get people into isolation or quarantine quickly, that can prevent transmission. So here at the health department, we've been doing case investigation and contact tracing since March 21st, when we had our first confirmed case in Berrien County. So that process has been ongoing and really widening since then. But we have a team of it's 9 full-time equivalents. It's probably closer to 15 or 16 people that have been trained in contact tracing and case investigation. And we're working to increase that capacity because we do expect our number of cases at any given time to continue to increase as testing becomes more available. And we also know right now, under the Stay Home, Stay Safe order, the average confirmed case has roughly 4 or 5 contacts. Yeah. But before the Stay Home, Stay Safe order was in place, there were people that had 20 to 30 close contacts that needed to be followed up with. So even if our number of confirmed cases really plateaus and is not increasing, the number of contacts that need to be followed up with will increase. So we're working to build our team, build our capacity. We have started to get lots of inquiries from those of you in the community who want to volunteer to help us, and we so appreciate that. We're working to understand what our process could be. It's not quite as simple as insert a person into a process. There's lots of protected health information, confidentiality, training that goes into this. As you might imagine, contact tracing is both a science and an art. There's the actual nuts and bolts of what do we need to do and how do we communicate it, but we're also asking a lot of questions of people, and not everybody wants to share all of that sort of information. And being able to build the rapport, have that relationship, make sure people understand how we're going to use that information, that's a lot of an art. So there's some training and some other things that go into that. So we're so appreciative. We have a great community here that wants to help, and we thank you for that.
Can you speak to who the county is following for decisions that they're making? Is it primarily the CDC, or where are we getting our information?
Yeah, so there's lots of guidance out there on how to make decisions. So the CDC really is the primary source of guidance for how to control transmission, how to mitigate mitigate and containment strategies. So we definitely do that. The state adopts a lot of CDC guidance and makes it tailor-made for Michigan, and sometimes adds additional layers to the CDC guidance. And so we do need to make sure we're in line with MDHHS guidance. At this point in time, we are not acting under any local public health orders per se. All of the interventions, the policy interventions for social distancing have come from the governor's office. All right, well, we are so glad that we had this opportunity to answer any of your questions. Please join us again here next week at 12:30 next Friday. If you do have additional comments or things that have not been answered through this video, you can continue to post those on social media, or you can contact us on our hotline at 1-800-815-5485. Thanks.